As we continue to recognize Breast Cancer Awareness Month, now is a good time to remind women about when, how, and why they need to check their breasts and have cancer screenings done. For this week's Take Action Thursday, Dr. Suman Rao, medical oncologist from MedStar Franklin Square Medical Center, is joining us to talk about it. Good morning.
Good morning.
So the research and the recommendations seem to change every so often. There's just a new one out. And I think it confuses people about what they're supposed to do, when to get their mammograms, all of that. What's the latest recommendation, and what are people to do?
Sure. So the latest recommendations from the American Cancer Society is that women between the ages of 45 and 55 get yearly mammograms.
45 now, and that used to be you start at 40.
It used to be 40. The guidelines now say 45 to 55 yearly, and then once every other year for as long as you're relatively healthy.
And why the change?
So the changes are reflecting the fact that breast cancer mortality or death due to breast cancer has reduced, and that screening women between the ages of 40 and 45 doesn't impact how long they live, even though it doesn't mean that a breast cancer diagnosis cannot be made in that age. It just means that it does not impact how long they live.
But that seems to go against the thinking that if I catch it earlier, then they can do something more with it in the early stages versus in a later stage. So the earlier I can get screened, the better. Why does that not?
So absolutely. I think the reason some of this is affected in part because we've gotten much better with treatments, even for early stage breast cancer. When it's detected in stage 1, stage 2, we have gotten much better with treatments. So there is an impact on survival. So we're reducing the death rate from breast cancer in general. So some of it is reflected by that. Some of it is also reflected by the fact that sometimes very early breast cancers do not necessarily go on to grow and cause problems for a woman. So it may be that we're picking up.
What happens to those?
They may sometimes never progress.
Okay.
Or sometimes they do in occasional cases, or in a small minority of cases, they just disappear. So we may be picking up very early breast cancer by doing a lot of mammograms that don't necessarily impact how long the patient lives, how long a woman lives, or grows into a breast cancer that is life-threatening to the woman.
One of the other things that the American Cancer Society in their new guidelines, they said you don't necessarily have to do self-breast exams anymore, which is also very counterintuitive to everything that women have been taught throughout their lives.
True, and so there is no real downside to doing breast exams, except that for some women it may increase anxiety.
Okay.
The reason why they're recommending this is that most studies have not shown an impact again on how long patients live or when cancer is detected by breast exams. It doesn't mean you have to stop doing it. It just means that picking up a breast cancer by self-breast exam does not necessarily impact how long you live.
Okay.
The one thing to take away from this is that these studies did not look at, does it reduce the rate of mastectomy? Did it reduce the rate of chemotherapy in these patients? So that is not looked at in these studies. The only thing they actually looked at was mortality from breast cancer.
All right, we're going to have you stick around and answer some questions about breast cancer awareness. So if you have a question, go ahead and put it on our Facebook page. You can also give us a call, 410-481-4545. The phone lines are open right now. 7:54 is the time. We are back with Dr. Suman Rao, medical oncologist from MedStar Franklin Square Medical Center, and she's taking your calls about breast cancer awareness for our Take Action Thursday. So if you have a question, the phone lines are open, 410-481-4545. We do have someone who wrote in on our Facebook page and asked this question, which ties into what I wanted to bring up with you again. We were talking before the commercial about when you should get the mammograms and all of the screenings. That is for healthy people. If you have a history of it in your family, there's a different set of guidelines. And that kind of brings in Nita's question here. She says, are you ever too young for mammography? I'm 33, and I was thinking that I should get one because my great-grandmother had breast cancer and beat it back in the 80s, but still it's in her family. So what's the line of thinking there?
Sure, yeah, so if you have a strong family history, these recommendations do not apply to you. You should discuss it with your gynecologist, with your primary care doctor, whether you should be getting screened early.
Okay.
The typical recommendation is that at least about 5 to 10 years before the youngest family member. So in your questioner's case, it was a great-grandmother. I'm not sure if there's any other family history, so that is not a very significant family history. And we don't know how young the grandmother was when she had breast cancer. So those are things to take into consideration.
We were talking in the commercial with the differing recommendations. I know that one of the concerns is what that means for health insurance. If you keep pushing the age up, will health insurances not cover it at a younger age? Or if it's a recommendation from the doctor because there's genetic history, it's likely still to be covered.
Yes, I think if there is a family history, if there is a strong recommendation, then that will be covered. I think the more important question is, will they back off on covering women without the family history, without a significant risk factor between the ages of 40 and 45, even though the women do want to get these mammograms.
And that's could be a concern for some people. Very interesting to know this stuff, though. Thank you so much for coming in. We appreciate it. All right, well, coming up, presidential